Hi, I'm François Gazano, and I'm the CEO of AthleteMonitoring.com. During this short video, I'll present the two main approaches of injury prevention and introduce an innovative software solution that helps sports organizations implement their own evidence-based injury surveillance program. There are currently two main approaches to injury surveillance. The traditional approach counts time loss and medical attention incidents reported by healthcare professionals. The novel approach, created by the Oslo Sports Trauma Research Center, count all incidents that impact the athlete's ability to train and compete. Incidents are reported directly by athletes. There are several problems with the traditional approach. First, it requires on-site medical personnel. Second, it only counts time loss injuries. Third, it only counts medical attention injuries. And as a result, it only counts a small fraction of the total health burden. The new approach has many advantages. First of all, it's scientific validated. Second, it can detect both time loss and non-time loss health problems. Number three, it doesn't require on-site medical personnel because it's the athletes who are entering data through their smartphone. Fourth, it tracks the severity of health problems over time. And the most important one is that it can detect 6.5 to 10 times more health problems than the traditional methods. Now, I will show how to implement this innovative injury surveillance approach using the athlete monitoring system. This is the health survey as it is completed by an athlete on a weekly basis. So there are 4 questions. The first one is on level of participation. Have you had any difficulty participating in normal training and competition due to injury, illness, or other health problem during the past 7 days? So that's very straightforward question, and then the athlete will have to select the appropriate answer. Well, full participation but with some problems. Then did you reduce the training volume based on this problem? Then the athlete can select yes, quite a bit. Has your performance suffer because of these health problems? No effect at all, could not participate. Well, but just a little bit. Symptom, did you experience any symptoms? Yes. Have you reported this problem previously? Yes. And then the history will pop up and the athlete can select the appropriate section. And no, then that's a new problem. Continue. And then the athlete can select the type of problem. There is some information here in case that this is unclear, but basically they can select an acute injury, an overuse injury, or an illness. If it's an acute injury, they can select the body area that is injured, and then select. So it's the shoulder. When did it happen? Well, it happened yesterday. And what were you doing? Well, I did a conditioning session. And how did it happen? Well, I just hit a player. And then I continue. Oh, time loss. Now you can collect time loss data. So how many days over the last 7 days you have completed missed training or competition due to this problem? Well, I missed 3 days. Did you contact the medical team? So those are all the medical professionals linked to their accounts, but no, they didn't report the problem. Comment, they can automatically easily enter their comments, provide more information about the issue, the context, and so on. And that's it. When an athlete self-reports a problem, the medical team linked to the account automatically receives a notification. This notification can be sent by email or SMS. The Health tab of the team dashboard automatically lists the detected problems. On the Health tab, you can immediately identify the new problems reported through a weekly survey. To edit an incident, click on the issue. Then automatically the information selected by the athlete is displayed on the screen, and the medical professional can assign the diagnosis. The health professional can also select the health menu to access the list of current problems. To access graph and statistics, simply click this icon, select the period, and then you have access to all the details, health outcomes. You can select and deselect the different options depending on what you want to see. Also add some text here, and select the print button at the bottom to generate a report. Producing injury surveillance statistics, it's also very easy. From the Health tab, select the Export button. You can select either injury log or injury surveillance statistics. Then you select your team on groups, select the time, and click Export. And after a few seconds, I can open the file. And here we are. Those are my statistics.